Well, for more on COVID-19, we're joined now by Dr. Rosie Chauhan, a medical analyst. Thanks so much for joining us. I want to talk about the state of the pandemic. The numbers are surging, probably because everything has opened up with virtually no restrictions in many places. So what lies ahead for us?
Thank you for having me. Well, I think we have a new normal. I think that the ebbs and flows of COVID are going to continue, and we're going to trudge through the Greek alphabet until we reach a resistant COVID strain or mutation or variant. So I think that we do need to pay attention to that. And as you say, it's not just it's due to a combination of everything essentially opening up, not just because we are facing variants such as Delta or Lambda or even more resistant ones coming up the pike.
Yeah, I was telling somebody I'm not so much worried about Delta as I am about Upsilon and the other Greek
Yes.
letters that come after that. You talked about a resistant strain. What happens when we get to that point?
Well, hopefully that some foresight from governments and those who develop vaccinations and pharma should be working on that right now as we speak. We should anticipate that. That shouldn't be a surprise when we face that. We should be developing vaccinations. In fact, I don't know that, I know that there's consortiums developing, extending from the WHO regarding vaccination access, but they really should be working on trying to encourage vaccine development in the light of the fact that COVID is not going to go away anytime soon.
This is a virus that knows no borders. The COVAX program was one of the global responses. How effectively is it working?
Well, it's a good idea and it's better than nothing, but it is based on goodwill from more developed or leading nations to donate their excess vaccinations or at least designate a certain number of vaccinations to other countries that may not have it or have harder access to it. But you know, even in rural areas of America, only 20% of people are vaccinated. So it's a combination of factors, not just geographical issues such as those maybe faced in Africa or etc., or financial issues faced in Indonesia or the Philippines, which COVAX is addressing. It's to do with education as well as access.
What changes in the global response do you think are necessary?
I think that it's very nice to have a consortium such as COVAX, and it's kind of more altruistic. But as has been demonstrated in the last year and a half or so, or since COVID has started, there needs to be political weight behind such organizations. And one has to consider whether something other than health organizations such as WHO, who does a great job in trying to help various countries who may lack facilities or access to the appropriate medications, etc., and vaccinations, there needs to be some political weight around this. Like, for instance, you know, I think it's naive to think that just China had development of, you know, virological adaptations, etc. There are labs across every country. Every country does this. Should there be a registry of countries who actually declare what kind of virology that they're manipulating? It doesn't have to be warfare, but you know. Viral adaptations, people have to know, are not bad. They're used in all sorts of medical treatments. For instance, there's approved, FDA-approved oncolytic medications based on this kind of technology in the treatment of melanoma. It's used in gene therapy. You know, so it's not a bad technology, but we need to know if there's going to be another pandemic. And just so you know, that when any kind of drug is made by a pharmaceutical company, they don't just aim for one product. They usually have several lined up in case one fails.
Yeah.
And that could be for this virus.
Dr. Rosie Chauhan, thank you so much for your insight.